It's good to be with you this morning. I take no credit for the jazz part of the resume. My wife and children actually are the musicians. I sometimes make noise and accompaniment, but they are the ones that actually make music. You know, I've changed this presentation several times over the last couple days as I've been listening to these discussions, and really wanting to respond to some of the interests that I'm hearing in terms of how do we really equip the church? What is the role of the church? How do we strengthen the church? So while I'll speak to emotional and spiritual care, I'd like to talk about that in the larger context of what is the role of the church in this work. And in doing that, I feel like, first of all, I need to challenge you a little bit in terms of how you think about disasters. In order to understand the power of the church and the role of the church, we need to think differently about disaster ministry and what it means. So I'm going to walk through that and present you with some examples, and then I hope to describe to you some models for how the church can engage in this work and be a force in the community. And then I want to do that and try to save a little bit of time because I want to invite your reaction and hear a little bit about whether you think those models are applicable, especially here in the Philippines. I've worked in a number of countries. Actually, my first visit to the Philippines was just back in April. Bishop F. invited me to join the group on a church building conference and then spend some time with him and a number of the pastors afterwards. So this is only the second time that I've been to the Philippines, which is to say that I do not claim to really know anything at all about the Philippines. So in that regard, I really depend upon you to help me to understand if this applies. So, as I said, the church has a very important role to play in disasters. But again, we need to not only rethink the role, but also understand some of the risks, because there are some dangers in this work, and they're not the physical dangers. And let me give you an example of what I mean. There's been some work that's ongoing in Africa, particularly in South Africa, related to the spread of HIV. And it was one part of the world where there were some very effective partnerships between NGOs working in this area and the local church. And there was an interesting evaluation that was done, where a team went in to look at the impact not only on the local community, and it was a significant impact. These were very successful programs. But there was also an impact on the church. In particular, what they found was that through those programs and through those partnerships, the churches began to change. In particular, they started to develop more programs that were aligned with their NGO partners and put less into programs that were not aligned with their NGO programs. Now, the people who did that study were not saying that that was good or bad. They simply said this was happening, and maybe people want to think about this. But they also pointed out that the NGOs, by and large, are not accountable to the local community. They're accountable to their funding sources, which, if they're an international NGO, those funding sources are outside the community, perhaps outside the country. And that might cause people to think a little bit. Now, here's my thought about this, and I'm sure you would have some thoughts about that. Whenever you have two partners and one of them is more resourced, has a clear mission, has a clear program, and they partner with an organization that perhaps has fewer resources and is not so clear in terms of programming, the clearer and more resourced partner will tend to dominate the lesser resourced partner. Now, that's not to indict the NGOs. They're just doing what NGOs do. What I think it says is the church needs to work at becoming a stronger partner. So I'm hoping that my remarks for the next, however long I'm up here, half an hour or so, might suggest to you how that can happen. And what are some ways in which the church can become a stronger partner? Because in the work we do at Wheaton College, Humanitarian Disaster Institute, that's one of our basic concerns, is how do we strengthen the church? In all of this work, how is it that the church can really see its power and to help other people government agencies and NGOs to also understand the power and the role of the church. And I'll explain a little bit more about that. So I'm suggesting to you that there is perhaps what we might call a distortion in relationship with the NGOs. But there's some more basic distortions in just how we think about disasters that are part of our nature and how we think, and I'll explain that. When you ask the average person about disasters, they usually think of extreme events. They think of tornadoes, they think of tsunamis, they'll think of an earthquake, something dramatic, something specific, something we will have a clear picture in our minds as to what that is. We're actually built psychologically to focus on those kinds of events. When something is dramatic, powerful, and clear, it tends to stand out in our minds. And when we think about things, we're more likely to remember those kinds of events and think that they're more likely. That is an experience bias that actually changes how people will report things. Psychologists have names for a lot of things like this. And when we have something clear and dramatic, and also when we tend to hear about it a lot, news reports, conversations, and so on, we tend to not only pay more attention to it, we think that it's more likely. It's called the availability heuristic, something that we've heard about more, we think, well, of course that's going to happen because I've been hearing about it a lot. To give you an example, in the United States, I would say, as a country, we're obsessed with terrorism. In 9/11, when those planes flew into the World Trade Center, that was a very dramatic event. Most of Americans can tell you exactly where they were and what was happening when those events took place. And so it tends to stand out in their mind then that that's a huge risk to the country. Well, the reality is that on average, maybe 11 Americans per year die in some event that's related to terrorism. You're more likely to die from a bee sting than die from terrorism in the United States. In fact, and I'm not making this up, you're more likely to die from accidentally setting your pajamas on fire than die from terrorism in the United States. On the other hand, an average of 36,000 people die from the flu just in the United States every year. And that's on average, depending upon the strain of the flu. It can be anywhere from about 15,000 to as many as 50,000. Not a pandemic, that's just the average flu season. You are 3,000 times more likely to die from the flu than a terrorist attack. But most people don't even realize that individuals die from the flu. Do I need to hold this closer? They don't even realize that that's a significant risk. But they're very aware of the risk of terrorism. In fact, there's another study that suggested that the deaths from automobile accidents in the United States have gone up by 1,500 people since 9/11 because people were afraid to get in airplanes. Insurance companies have found, if you say to somebody, here's a flight insurance policy that will protect you from a terrorist attack, they'll pay more money for that than a general flight insurance policy, even one that includes a terrorist attack, because if you say it's specifically about terrorism, it stands out to them as a much more significant risk. And so that's a distortion. Those are examples of how that happens in the US, but generally, people have a distorted view of risks related to disasters. So it distorts how we think about risk, it distorts how we then think about programs related to those risks. To use another example, I tried to find some numbers related to the flu mortality rate in Japan, and I found some that suggested it's close to the rate in the United States. So if you adjust that for the difference in population, and I can't confirm this with numbers, but it's my deduction, the number of people in Japan since 3/11 who have died from the flu is greater than the estimated number of people who died in the tsunami. And as time goes on, that number is going to get greater and greater because that's an annual number. And so again, it's a distortion in terms of how we think about risk and also how we think about serving people. Because in many ways, those people who are dying from the flu are the same people who are at risk in terms of the other disasters. And I'll explain a little bit more about that. So, a number of misperceptions. Because we tend to think of extreme events, we tend to think that disasters means doing relief work. Now, I know that many of you are involved in development, and actually it's been very interesting to hear how many people have a greater understanding of the connection between development and relief work. But when we talk about, we have a Humanitarian Disaster Institute, we're doing work in this area, what we often find in audiences is they quickly say, oh, are you responding to tornadoes? Are you sending people out to clean up after hurricanes? And we're not doing any of that. We're really looking at the role of the church in relationship to strengthening the community. But there's a distortion, not only in terms of emphasizing relief work, but then because of that, thinking that disaster ministry requires more technical work. We think of it as something different than the basic work of the church. And I think that that's a distortion. Consider these examples, and I'll give you an idea of where the work of the church may lie. I pulled a couple of examples of disasters that probably don't happen here. One is ice storms. This is the 2002 North Carolina ice storm. Now, and to explain what this is, when an ice storm occurs, it starts with warm air and rain. So you're in just a typical rainstorm. But then you have a very cold, dense body of air that moves in and under the warm air. So now you have warm rain that falls into cold air, and when it strikes the ground or other surfaces, it freezes. The other thing about an ice storm is it can happen very quickly. The year before this storm in North Carolina, I was living in Maryland, and the same thing happened there. You can be literally driving down the street on a safe but wet road, and in minutes, it'll be covered with ice. It covers everything around. It covers the trees, brings down power lines. In this storm in North Carolina, 1.3 million people were without power for 2 weeks in the middle of the winter. Now, what happens then, because they're without power, and because the damage is so pervasive, it takes a long time to get that back up. Then, depending upon where you live and how well your home is insulated, in anywhere from half a day to several days, your home is the same temperature as the outside. And in the middle of the winter, if it's 20 degrees outside, that can be disturbing. Now, I grew up in New England. I've lived through a lot of ice storms. I'm sorry? Oh, right, yeah, I'm talking Fahrenheit. So I've lived through ice storms. You throw a few logs on the fireplace, you bring the blankets down the living room, the family camps out in the living room and waits for the power to come back on. But if you're from the South, especially if you're from Latin America, you don't know that. You may never have been through that kind of freezing weather. You especially don't know some of the dangers of trying to heat your home. Now, when these things happen, the health department usually has a big campaign to educate people and to say to them, don't build fires in your house. Don't use kerosene heaters. Don't bring the barbecue grill inside unless you have some way of venting it from the outside. But some people, for example, immigrant workers coming into the U.S., who could be in the U.S. illegally, they're not going to go to the health department and ask for assistance. They're not going to go to people and say, we're freezing, can you help us out? You're going to stay under the radar because you're afraid. And then you may think, we're freezing, let's fire up the kerosene heater. And you fill your home with carbon monoxide, and the whole family dies. The 38 people who died in this ice storm did not freeze and did not die from automobile accidents. They all died from carbon monoxide poisoning. On top of that, most of those 38 people were immigrant workers. They were people from outside the community who didn't understand that particular storm and were afraid to ask for help. So in a sense, you could say, those were not storm deaths. Those people died of their vulnerabilities. They fundamentally died because they were isolated and because they were afraid. To use another example, there we go. Tuscaloosa tornadoes. Do you have tornadoes in the Philippines? Not very often. Worldwide, there's about 2,000 tornadoes a year, and anywhere from 2/3 of 3/4 of them take place in the United States. Most of those in the south central part of the United States. The Tuscaloosa tornadoes was the largest outbreak of tornadoes in the history of the United States. 358 tornadoes took place in 2 days. One of those near Tuscaloosa, Alabama, was an F5 tornado. An F5 tornado has winds that exceed 260 miles an hour. That particular tornado was 1.5 miles wide. It was so powerful that as it rolled over homes, it didn't just pulverize the homes, it actually pulverized the concrete slabs the homes were built on, so that after it passed, there was nothing left but dust in the wake of this monster. 240 people died. Now, the distortion in this particular case, when people see a monster tornado, like the one in the picture down here, you tend to think it's an equalizer. It doesn't matter what your income is, it doesn't matter what your house looks like or how big your house is. If you're in the path of this thing, you're in deep trouble. And so you might think that the mortality rate cuts across the community. It'd be logical to think that, but you'd be wrong. The University of Alabama actually put a team together to ask a very simple question: who were the people who died? In fact, the #1 weather-related killer in the world is heat. More people die related to heat waves in the United States than all other weather events combined. All tornadoes, all hurricanes, all weather events, far more people die from heat waves. Now, the interesting thing about that is that Illinois is not a hot state. My elderly mother lives in Texas, and just to give you a comparison, and this is in Fahrenheit, from late April until now, most days the temperatures there have been in the 90s, and many days have been in the hundreds. In contrast to that, in Illinois, I think the entire summer we've had maybe 10 days where the temperature got as high as 90. Yet far more people die from heat in Illinois than in Texas. Frankly, more people die from heat in Illinois than any state in the United States. So why is that? You can't explain it just by the weather. Something else is going on there. In 1995, there was a major heat wave that was the source of an extensive study. 750 people died in 4 days. Most of those people lived in the city of Chicago and lived in poorer neighborhoods in older tenement buildings, like this building in the middle. If you wanted to design a building to soak up heat, you couldn't do better than that building. It's poorly insulated. It has a flat roof that's painted black. It has an older electrical system. And that's one of the key differences between the infrastructure in Chicago compared to the cities in the South. The cities in the South built for heat. They understand heat. They took that into consideration. It never used to get very hot in Illinois, and it's getting warmer all the time. So now you have people in these old buildings, and then the heat wave starts to hit. And then a few other things happen. One is people open up fire hydrants. They want to cool off, they want to play in the water. It drops the water pressure, which impacts the cooling capacity of power plants, and now the power starts to go out. And so now even if people have air conditioning in window units, they have no power to power them. And pretty soon, the apartments in these buildings are over 100 degrees Fahrenheit. Now, that's not the end of the vulnerability. Most of the people who died were elderly people who lived in areas where there were high crime rates, and they were afraid to go outside of their apartments. In fact, even when the health department sent out teams to find these people and bring them to cooling centers, they were afraid to answer their door when there was a stranger there. So these people died at a very high rate. The city did learn from that, and the health department established teams to reach out to individuals to get them assistance. What they pretty quickly found was that You can't wait until there's a heat wave and then go out and expect the people are going to open their door to you. You've got to build a relationship with the community. But if the health department did nothing but work on building relationships, they wouldn't have enough people to do it. That's a task that's beyond the government. And so they began to realize we've got to form partnerships. We've got to work with somebody else who can have a relationship with these people and help us to reach them. But once again, you'll see these people are not dying simply because it's hot. They're dying because of their vulnerabilities. And that's a key message that I wanted to share with you. Again, in thinking about disasters, because we tend to focus on the extreme event, and we tend to think about disasters in terms of those extreme events, in terms of the earthquake, the tornado, the typhoon. And so I'm wanting to flip that around and suggest to you, let's start thinking about disasters more in terms of the vulnerabilities, and what are ways then in which we can be engaged in programming to address those vulnerabilities. This is just to emphasize this. You saw on the previous slide, the 750 deaths in Chicago was nothing to compare to that heat wave in Europe, killed 70,000 people. One of the reasons that it's a bit fuzzy in terms of the global impact of heat waves is there really are not good statistics from many of the developing world countries, even though they're exposed to significant heat waves. So it's still just an estimate of global impact. But many people are warning that's going to become a greater and greater threat globally in the future. Oops. Another distortion related to disaster work. When we think about extreme events, then we tend to think of, well, who are the people who are immediately impacted by those events? Who are the survivors? How do we get out and do a specific ministry for those survivors? And we tend to adapt our program around those particular survivors. So another way to think about that involves what are called syndemics. Syndemics is a word based upon the idea of syncretism or syncretic events. Those are events that tend to go together driven by an underlying event. Syndemics occur when there are multiple disease processes, mental health processes that are occurring together because an underlying disruption. Disasters create syndemics. And they tend to create them across the community, not just in the people directly impacted. So when a community experiences a typhoon, an earthquake, tornadoes, the impact is not just those who are in the immediate path of that extreme event, but an entire community will be impacted. So rates of depression will go up. Rates of abuse and violence will tend to go up across the community. Alcoholism and drug abuse rates go up across the community. So the impact tends to be much broader. And this is an issue that has particularly come to the attention of CDC, Centers for Disease Control in the United States, which is responsible for these disease processes. And so they've actually made that a strategic priority to try to have a better understanding of how does this happen, that an event may impact a specific group within a community, but the entire community is suffering the impact. But again, as we think about ministry and think about how we are working with the community, it's a distortion to focus too narrowly just on those who've suffered the immediate impact. We need to think more broadly in terms of how an entire community can be impacted. And then another misperception, this is something, again, we see often in other places. The main thing we need to do is explain these risks to people. We need to get more information out there. If people know the risks, then they'll take steps to protect themselves. Well, that's a dubious assumption at best. In general, the research is that information by itself does not get people to take action. And that's a concern because a lot of disaster information campaigns, public health campaigns, they're basically information campaigns. And there's some real questions as to whether or not they work at all. But there is some research that suggests how they can work. And the key to it is to understand that information has a context. What I mean by that is, when you're getting information, you're getting it from someone or some place. And the credibility you give to that information, whether or not you'll consider acting upon it, has to do with your relationship with that source, among other things, but it starts with that. If it's not a trusted source, then you discount it and it doesn't go any further. But there then are a number of things that need to happen in reaching out to people with information. One of the first is there must be trust between the information giver and the information recipient, that trust based upon a belief in the information source's good intentions. You have the recipient's best intentions at heart. You're not trying to manipulate them. You're not trying to get anything from them. The information must be clear and practical. That is, the person must see it as something that's possible to do. Sometimes information campaigns, in order to motivate people, think they really need to emphasize the disaster and all the horrible things that can happen to people. But what happens is, if it seems so overwhelming, people conclude that it doesn't matter if they do anything, it won't make a difference. There are some information campaigns that have actually resulted in people becoming less prepared and less attentive to disasters because the information was so overwhelming. So one of the key things there is that it must be clear and it must be practical. It has to be in terms of something a person thinks they can do that would make some difference in this particular situation. And then the third thing they found that's very interesting, then all of that needs to be followed by a conversation. There needs to be a dialogue where the person that you're hoping will act and do something gets a chance to talk about what they think about that information, what they think about what you're asking. To talk with you about their needs, their concerns about the program. And when you have that dialogue with a trusted party, then people are much more likely to follow through and do something. So again, my point in all of this is, it's the key to a lot of these things is the relationship with the community, in particular, a relationship of trust with a member of the community that you're trying to help. That's all about relationship, and it takes time to build a relationship of trust. So the key message so far is to say, disaster work fundamentally is attending to people who are vulnerable, and beginning to care for people who are vulnerable begins with building a relationship with trust. But let's take a moment and ask then, who are the vulnerable? And what do we mean by that? So, as I'm sure you know, and as you saw from my examples, disasters disproportionately impact the vulnerable, but vulnerable is not the same thing as poor. Poor is one way to be vulnerable, but as you'll see in a moment, there are many ways to be vulnerable. In particular, there are some groups that are vulnerable over the whole life cycle of a disaster. Consider an elderly person on multiple medications. A flood, typhoon, something comes through that damages the community, and now their physician is no longer available. Maybe the pharmacy where they bought the medications has been destroyed. They no longer have access to those medications. They're running out of medications. They don't know where to find that support. And so now you have not only the immediate aftermath of the disaster event, but it's being compounded by their vulnerability and the continuing need for support from the community. This may look familiar. Professor Luna showed a similar map the other evening. He showed you a risk map. Risk actually is the sum of exposure to a possible disaster and vulnerability to a disaster. And so to really understand risk, you have to understand vulnerability. Now, if you look at this, you'll see the United States actually is pretty moderate in terms of its exposure to weather. Here's Japan, very high rate of exposure. Here's the Philippines, high rate of exposure. So that means that disaster events occur at a fairly high rate. But when we look at vulnerability, and by vulnerability what we mean is the likelihood that a disaster event will be destructive to the community, and just how destructive, then you get a very different picture. The United States actually has very low vulnerability, as does Japan. For example, The earthquake in Haiti killed over 200,000 people, and they're still cleaning up the rubble in Haiti. The earthquake in Japan was 100 times more powerful than the earthquake that hit Haiti and killed roughly 23,000 people, and most of those from the tsunami, not from the earthquake. That's the difference in vulnerability and what a difference that makes. You can also see that in this whole region, it's relatively high level of vulnerability. The Southeast Asia region is the #1 disaster vulnerability and risk region in the world, and the Philippines, as you probably know, is the #3 in the world in terms of disaster risk. So that says a little bit about vulnerability, but that's still a bit misleading because it gives the idea, for example, that in the United States, that's homogeneous. But if we drill down a little bit further, this is a vulnerability map just of the state of Illinois. Now there's two maps because they use a different comparison. And one is a comparison to the rest of the United States, and one is just within the state. But a couple things I would point out to you here. One is how varied it is, even within one state within the country, and a pretty well-resourced state. Illinois, compared to other states, is a very wealthy state. But you'll see that there's a number of counties in different parts of the state that actually are quite vulnerable. You might also see that there's some areas where you have a county of very low vulnerability right next to an area of high vulnerability. What you don't see on this, because we don't have all the underlying data, is that even counties next to each other who are vulnerable can be vulnerable for different reasons. My point is, vulnerability is local. To really understand the vulnerability in the community, you need to understand that local community. And it's very easy to make generalizations and misunderstand those needs. Even where there are areas of comparable vulnerability, as I said, there can be very different reasons behind that. And this was one map that I was able to find in terms of Mindanao. There's some work going on now to also map different parts of the Philippines in terms of vulnerabilities. And again, you can see just how varied it is, given the little bit of data that was available here up in Mindanao. So a great deal of variation right down to the local level that's important to understand. So, I thought I must come up a little bit later on. I'll show you in a moment if we look a little bit closer at that in terms of then what makes up vulnerability, because that can be important to understand in terms of ministry. And I need to move a little bit quicker. Okay, so what do we do about that? I'm going to suggest to you 3 different models for how a church can get involved in this work. And I'm going to describe them as the church as a bridge, the church as the resilient community, and the church as a healing community. Church as a bridge, what does that mean? Well, literally a bridge is spanning some kind of a gap. So when the church is a bridge, what it's doing is connecting parties. For example, connecting a less resourced church with a more resourced church. Or another way to bridge is in terms of connecting the community with technical resources. It can be a bridge. Let's use the example of our guest from Ethiopia who asked the other evening, we increasingly are facing droughts. What can we do about this? Well, the church in Ethiopia should not try to become experts at solving the problem on droughts. There are people in the world who truly are experts at that. What the church in Ethiopia needs to do is to become a bridge between those who know how to solve the problem and those who need the problem solved. And that's a relationship that the church is uniquely positioned to do because of its relationship with the local community. When you are a bridge, you can leverage the relationship and trust you have with the local community so that those with resources, those with technical expertise, are in a better position to be of help to the local community. And so that's actually a very important role that the church is able to play. In South Chicago, there's a Methodist church that's doing this. It's really focusing on public health issues. It's serving a poor and disadvantaged community. They're very concerned about issues of public health and health care. So they've established a calendar where each month is focusing on a different issue of importance to the community. This is a community that does not access public services and does not trust the government. And once a month, they'll bring in somebody from a government agency that will explain what it is that agency does and what's available to the local people. And then spend some time there so that individuals can talk with that government representative and get to know them and start to establish a relationship. The church is leveraging its trust relationship with the community to help build a trust relationship with that government agency. That's a kind of building a bridge of trust so that those who need services will know where they are and be more likely to access them. There are many other examples. Our institute at Wheaton College has been approached by a number of governments in different states to help create a bridge between government and the church. We've worked with the Public Health Department in Chicago in particular to create a public health education program that could be delivered by the churches. And so we actually convened a group of church representatives and said, here's the expert information that the Public Health Department has. Now let's work together to turn this into something that's understandable by the members of your church and that you can deliver to them. And so we were facilitating the process and doing the writing. The members of the church were telling us how to design this so that people would understand it. And through that program, creating a bridge between the city public health department and the local church. So that's another example of bridging. We also focus on bridges going the other way. Governments need to have a better understanding of the church, or at least this is my experience in other parts of the world. They don't understand what the church does. We'll set up meetings and invite people from public agencies, sometimes the American Red Cross, and they'll say, great, we want to talk to the church. We could really use some more volunteers. Or the church has some meeting space. We'd really like to hold some space there. They don't really understand the relationship between the church and the community and how the church is in a unique role in terms of being able to explain and leverage those programs back to the community. The church as a partner. The church should not do what the public health department does. They shouldn't do what the NGOs do. They should be the connector, the facilitator, the ones that help to establish that trust relationship and help those programs be translated, to the local community. Or to use a different example, Habitat Humanity does wonderful work. World Vision, Food for the Hungry, these are wonderful programs. But the church should not become Habitat for Humanity, should not become World Vision. The church should be a partner and do what the church does, which is to be a force in the community and then through the church become that bridge that allows these programs to better serve the community. To be a stronger partner then doesn't mean being passive and just letting anybody come and work through the church. You're in a position to know the community, who's vulnerable, who needs these programs, and then to proactively say who needs to be connected so that our community is better served. So rather than connecting people in the community because they've come to you first, to also engage with the community and know your communities well enough so you know what they need and know who can be trusted to work with those communities. That's what it means to be a bridge. Second model, resilient community. Resilience is basically the ability to bounce back. Resilient communities are communities that are less vulnerable to disasters. They are better resourced. When disasters do strike and they're damaged, they recover from that more quickly. They're less likely to experience the long-term negative impacts of some kind of a disaster. A resilient community is a community that's characterized by partnerships across the community. Or to put it another way, the more that a community is divided into compartments of people that don't talk to each other, that don't work together, the more vulnerable the community is to a disaster. Because the more difficult it is to orchestrate the resources of the community, the more difficult it is to actually prepare people. Conversely, when people in the community work with one another, understand one another, then the entire community becomes stronger. Part of that in a resilient community is knowing and protecting who's vulnerable. My example from Tuscaloosa, Alabama, that was a failure to know who was vulnerable and take steps to protect them. The disaster reveals the nature of the community. It doesn't cause the deaths. It reveals people who are vulnerable to being killed, and that there's a lack of programming, there's a lack of character in the community to protect those people. Resilient communities are in a process of constantly working at communication, at partnership, at knowing who's in the community, knowing who's vulnerable. When those immigrant workers in North Carolina were there and they were isolated from the community, that was a failure of the community to recognize who was in that community and how they were vulnerable. In fact, FEMA, the agency responsible for disaster response in the US, the Public Health Department, they're actually prohibited by law from discriminating on the basis of citizenship. If there's a disaster and you need help, it doesn't matter if you're a citizen of the country or not. And the agencies can't even ask you for any identification of citizenship. But most people don't know that because they're afraid. And it takes somebody who understands that and will reach out to those people to overcome that fear. The other thing that's interesting in this regard, in studies looking at developing resilient communities, one of them actually asked, so churches are doing this, NGOs are doing this, what's the difference? This is a secular agency asking the question about churches, and they said, one thing sets the church apart from all the NGOs. It's their ethical and moral framework that's behind the work that they do in reaching out to communities. Vulnerability, age, obviously very old, very young, more vulnerable. Employment loss. You know, I have a job that could be done from anywhere. As long as I have my laptop, I can work anywhere. It makes me much more resilient. If you have a job that depends on the location, you work in a manufacturing plant, you're a fisherman, you depend upon a boat, and that's lost, you've now become long-term unemployed. You're much more vulnerable. It's an example of what impacts the resilience of the community. And we'll share this PowerPoint, so you'll have this entire list. But if you were to ask what makes our community more vulnerable, these are the kinds of things that you would look at and the kinds of things that you would begin to address. The counterpart to that in a highly resilient community, there's a sense of a community. That is, we are all in this together. We are working together. And that's one of the basic characteristics of a more resilient community. I'm going to move a little more quickly. Here are some programs that actually help to create that. For example, a program in Alabama was very interesting. They started educating adults with elderly parents how to recognize the risks that their parents face and what they as their children can do to better protect them. And this was something that was routinely taught within the church. Inventorying community assets. There are programs that actually teaches local neighborhood teams to go out and identify what are the risks in our neighborhood and what are the assets and resources that we have. That's a program that's going on in LA, for example, where the Public Health Department is acting as the technical resource. They provide the tools and training for the teams, but the teams go out in the community and identify vulnerabilities and risks. So, basic message, people who are vulnerable medically, economically, socially are also vulnerable to disasters. Focusing on those who are vulnerable cuts across all these different disasters and reducing the fact that they will be more destructive and the amount of harm that will be caused. Lastly, church is a healing community. The church is the place that, at least in the US, most people turn following a disaster. Even where there are extensive mental health services available, following a disaster, people will go to their pastor first. So there's a great potential there, not only in providing care, but also in helping people to understand what's the meaning of this disaster. What does this tell me about the community, about my life, about my relationship with God? The church is in a unique position to help with that. And I'm sure these are just two examples. There are hundreds of examples in Scripture that are talking about the church as a body being characterized by relationships based upon humility, compassion, kindness, gentleness, patience. It's that kind of relationship with the community that positions us to help both in terms of generally working with the vulnerable and also caring with those who have been harmed by this. And by the way, just a quick comment, I'm not sure we realize how unique that is. In this day and age, we tend to take empathy for granted. We tend to have much more of a sense of what other people go through. This was developed at a time when people who were common criminals were still crucified. It says something about a community that can think up something like crucifixion. There has to be a real sense of not appreciating the horror you're subjecting someone else to. In that sense, it shows where empathy and sympathy are relatively modern concepts. This idea of relating to people out of compassion, kindness, humility was revolutionary. It really distinguished the church even more so at that time. It's perhaps less of a distinctive in our day and age, but we should remember that that's still a characteristic of the church and how the church sets itself apart. So just some other examples in terms of how the church works. Emotional and spiritual care, reaching out to people and caring, identifying those in need, looking to public health. Public health can be a way to build a basic relationship with the community because it often requires a continuing relationship, continuing working at educating people, continuing to address different public health related issues, and it gets you away from the episodic focus of crisis events. Then that builds a foundation that you can build upon for those extreme events, because now you have people engaged in ministry on an ongoing basis. They know how to do this kind of work. They have relationships with the community, and when a crisis event strikes, then you have a core that you can draw upon for more effective crisis work. And a little bit more about that. So what's the message then? Bottom line. Broaden how you think about disasters beyond the crisis event. Think in terms of the real issue being not just the event, but those who are vulnerable to it. Vulnerabilities reveal the character of the community, and they define the opportunity for the church to play a powerful role that really cannot be played effectively by anyone else. There is no other organization, certainly no government organization, in the place to reach into the community and address those vulnerabilities. Think locally, think in terms of being a bridge. So I hope within that there's some helpful thoughts. Thank you very much.